4 years after the start of the global COVID pandemic, more information continues to come to light about how some states may have mishandled the crisis, including in one of the hardest hit states, New York. In March 2020, then Governor Andrew Cuomo, a Democrat, issued an advisory that forced New York nursing homes to readmit patients who had been hospitalized with COVID with no requirement to test them first to make sure that they weren't contagious and wouldn't spread the virus among the other vulnerable residents of the nursing homes. Now, Cuomo has attempted to defend the decision. He claimed it was following guidance from the Trump administration, though the Trump administration disputes that. Critics say the policy, either way, resulted in thousands of needless deaths. A 2021 investigation by New York Attorney General Letitia James, also a Democrat, found that the New York State Department of Health under Cuomo, quote, undercounted nursing home COVID deaths by as much as 50%, unquote. And a 2022 audit by New York State's comptroller, also a Democrat, concluded that former Governor Cuomo's health department, quote, failed to account for approximately 4,100 lives lost due to COVID-19 in New York nursing homes. Just last month, the chair of the Select Subcommittee on the coronavirus pandemic in the House of Representatives, Congressman Brad Wenstrup, subpoenaed former Governor Cuomo. And Ohio Republican Congressman Brad Wenstrup, the chairman of the subcommittee, joins us now. Chairman Wenstrup, thanks for joining us. You have an announcement to break right here on The Lead about how former Governor Cuomo has responded to your subpoena. What is the news?
Yeah, well, I do want to say, and we'll be putting something out shortly, but I'll tell you here right now that Governor Cuomo will be appearing before our Select Subcommittee on the pandemic on June 11th. This will be a transcribed interview at 10 a.m. This is 9 months after we initially started reaching out to the governor to ask him to come in and testify in front of us. We were ignored on many of our requests. There were delays. We subsequently had to issue a subpoena. We did that on March 5th, subpoenaing the governor for May 24th. And it was only not until then that he decided that he would come in for a transcribed interview. Just understand the difference between a subpoena ordered deposition and a transcribed interview. They're slightly different, but both of them, you cannot lie or it's prosecuted.
So just to be clear though, this will be not public and it won't be under oath, even though obviously either way lying to Congress is a crime.
You've got it. We'll make it public eventually, but it will not initially be public.
Who else from the Cuomo administration are you going to talk to, if anyone?
Well, we're already confirmed that we're going to hear from Governor Cuomo's former secretary, Melissa DeRosa. We're going to speak to about 3 members of his task force, medical advisor, Dr. Adams, and Dr. Howard Zucker from the New York Health Department. And we're looking forward to hearing their versions of what took place because the governor wants to say that he followed CMS guidelines, but if you follow the dates, he did not. The guidelines came out in March 13th, 12 days before he issued his mandate for the nursing homes to accept COVID-19 patients.
What are you trying to learn from Governor Cuomo?
Well, I'm trying to learn why he would do something like this. As a doctor who has treated infections, it goes against all medical common sense to take someone who is highly contagious and put them in amongst the most vulnerable. The idea is to quarantine and to treat them. And that is not what took place here. And the question is why? What kind of medical advice was he being given? What was the motive for wanting to do this move that clearly goes against, as I say, medical common sense? And I think if I did something like this as a physician, I would be accused of medical malpractice.
Your press release states, quote, evidence also suggests that former Governor Cuomo engaged in a cover-up to hide the true New York nursing home mortality rate from the public and shift political blame away from his administration. I know, obviously, that both the New York Attorney General and the New York Comptroller, both of whom are Democrats, have said that the Cuomo administration undercounted COVID deaths from the nursing home rule. But is there actual evidence of an alleged cover-up? Because Cuomo has obviously been denying any wrongdoing.
Well, he's going to have the opportunity to deny that again and take a look at what some of the other people are saying actually took place, and whether it was intentional to play those numbers down or whether it was just miscounting. So those are the types of things, Jake, that we need to get to the bottom of.
Nursing homes aside, a Los Angeles Times analysis finds that between 2020 and 2023, quote, deaths by age group, as reported by local health departments, shows New York City recorded a COVID death rate 40% higher than Los Angeles counties. New York got hit earlier than LA, giving LA more time to prepare, and the difference in vaccination rates and mask mandates could have also been factors. Given that, how difficult is it to determine how various policies played a role in the discrepancy between the death toll in Los Angeles and the death toll in New York?
Yeah, well, you're not going to see necessarily the virus literally being seen jumping to a vulnerable patient in a nursing home. But I think those numbers will speak pretty clearly for themselves. And again, it goes against medical advice, and it goes against medical common sense. And so when you see numbers and you say elderly, well, elderly where? Were they elderly that were in nursing homes where they accepted COVID-19 patients? Were they in nursing homes where the nursing home was prohibited from testing patients being readmitted or admitted for COVID-19? So a lot of those things I think will speak for themselves if we get the accurate data based on all the surroundings of who was placed where and when, and who was infected with COVID and how many people actually died subsequently.
Republican Congressman Dr. Brad Wenstrup, thank you so much. Appreciate your time, sir.
Thank you, Jake.
The lead did reach out to the former governor for comment. A spokesman for Andrew Cuomo told us, quote, there is no news here. We agreed to do this months ago, unquote. We should note the committee, in response to that statement, tells us that Cuomo did not actually confirm a specific date for his transcribed interview until 2 days ago. Governor Cuomo has an open invitation to appear on the lead to answer any of our questions whenever he has the time.